Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. It occurs in about 1.1% of the population and is usually diagnosed from ages 18 to 30, but is unlikely to be diagnosed to ages after 45. The causes of schizophrenia are genetics, the abnormalities in the brain's chemistry and structure, or possible viral infections and immune disorders. An example of this would be babies whose mothers get the flu while they are pregnant are at a higher risk of developing the disorder. People who are hospitalized for severe infections are also at higher risk. Early warning signs of schizophrenia are hearing and seeing something that isn't there, constant feeling of being watched, peculiar way of speaking or writing, strange body positioning, just change in personal hygiene or appearance, change in personality. Yeah, man. Yeah. Inappropriate or bizarre behavior. I can't do anything for that. Irrational, angry, or fearful of loved ones. If you experience several of the symptoms for more than 2 weeks, seek help immediately. Paranoid schizophrenia is when a person is preoccupied with delusions or hallucinations. Symptoms often blur the line between what is real and what is not. Paranoia in paranoid schizophrenia stems from delusions, which are firmly held beliefs that persist despite evidence shown, and hallucinations, which is seeing or hearing things others do not. An example is someone with schizophrenia might think the government is out to get them.
Not today, government.
Positive symptoms are the presence of inappropriate symptoms. Negative symptoms are the absence of inappropriate ones. There are 2 types of delusions: delusions of persecution and delusions of grandeur. There are 3 stages of paranoid schizophrenia. Prodromal, which is the onset where negative symptoms mount. Active, which experience perceptual distortions. And residual, the hallucinations and delusions attenuate. The types of treatments for paranoid schizophrenia are antipsychotic medication, which is most typically prescribed, typical or atypical. There's psychotherapy, which is the substance abuse treatment, if present, and the rehabilitation or the vocational training plus support groups. Then there's electroconvulsive therapy, which is the stimulating the brain through electrical currents. And then there's hospitalization.
The government's not watching you.
Keep your voice down. Hi, I'm Bryson.
Hi, Bryson.
And I have paranoid schizophrenia. Disorganized schizophrenia is a severe type of schizophrenia characterized by purposeless and incoherent behavior, thought, and speech. The patient's words and actions may not make sense and may be silly or inappropriate. Their emotions can range from flat or dull to agitated and aggressive. The patient is unable to perform basic daily activities or self-care. Some symptoms of disorganized schizophrenia are active behavior, anhedonia, avolition, and disorganized thinking. Oh my freaking God, he's freaking dead. The treatments for disorganized schizophrenia are the same as paranoid schizophrenia, which are natural remedies, antipsychotic medication, psychotherapy, electroconvulsive therapy, and hospitalization. Catatonic schizophrenia is a type of schizophrenia characterized by marked psychomotor disturbances, which may include immobility, negativism, and peculiar movements. You're just stupid. Like, ugh. Oh my gosh. Diagnoses that doctors use for catatonic schizophrenia are physical exams, MRI and CT scans, EEG scans, and psychological evaluations. Treatments for catatonic schizophrenia are medications like tranquilizers and antidepressants, ECT. Undifferentiated schizophrenia is characterized by the presence of prominent psychotic symptoms but not classifiable as catatonic, disorganized, or paranoid. Some symptoms of undifferentiated schizophrenia are hallucinations, delusions, disorganized speech, catatonic behavior, lack of speech, apathy, and emotional flatness. And the treatments for undifferentiated schizophrenia are all the same because it's all three of them combined. I really gotta keep a calm face.
I can even look at you.
I laugh too much. Okay. There are 3 stages of paranoid schizophrenia.
A plus. Why do you write with a plus?
It's me.
Hey, okay. I gotta change my shirt.
That's true.
Positive symptoms Okay.